Welcome all. As you are aware, we have started this session at Plastic Surgery Education called Candid Conversations. And this is an attempt to have conversations with our pioneers, our stalwarts in our fields who have contributed significantly to the field of plastic surgery. And we intend to discuss with them absolutely nothing about plastic surgery, but in general about life lessons and their experiences, their insights, and we try to learn from them. So our today's guest is Dr. K.Sridhar. He absolutely needs no introduction to all of us over here. But just as a matter of formality, I'll need to introduce him. He is the current director of SIMS Hospital at Chennai. He is the former pro VC of medical section of the SRM University Chennai. I believe hardly two plastic surgeons I know who have been pro VCs of universities. So that is a very prestigious position. He is the past president of our own Association of Plastic Surgeons of India. He has received the APSI Outstanding Teacher Award. He has received the APSI Plastic Surgeon of the Year Award, Lifetime Achievement Year Award by the MGR University. And there is an endless list of orations which he has received. He's also the member of the expert committee of ICMR on cleft lip and palate. And more importantly, which is very recently declared and awarded, is that he is awarded the Pioneer of Hand Surgery Award of the International Federation of the Societies of the Surgery of the Hand. I think that is a very prestigious award, and very few plastic surgeons from India have had the fortune of being awarded that particular award. So, welcome, Sridhar sir.
Thank you, Nikhil, for the nice words.
Thank you, sir. So, I think you were the first resident of plastic surgery at Stanley when the department initially started. From being the first student of a reputed institute, you were a part of growing the reputation of Stanley as well, to becoming the pro VC of SRM Institute at Chennai. Could you tell us a bit about how your journey has been?
Nice. Actually, when we started the plastic surgery department in Stanley as a teaching, I was the first candidate along with Dr. Balakrishna, Professor G. Balakrishna, GB, fondly called us. Both of us were the first set of students. And only one MCH trained assistant professor was there, Dr. Nirmala Subramaniam, and nobody else. And all others were either MBBS or MS General Surgery. They were called as tutors those days. And only assistant professor was Nirmala. So there were no seniors for us to guide. We don't know exactly what is plastic surgery exam is going to be, how it is going to be taught. Nothing we know about it. That's first. Second thing, of those days, I joined in 1978, way back. And understand it's about 46 years back. So at that time, there were no journals which are available. And there is only one set of Converse book. So that book we have to share and read. So initially we used to just give one book to each other and then one volume and then start reading. Later on, as we started, one of us will read, other one will listen. Like that was our education. So few classes, clinics, journal clubs. And of course, we used to have routine daily meeting alternate days. That is Monday, Wednesday, Fridays, we used to discuss all the emergency cases. We had a very tight schedule. I learned a lot of hand injuries there because on an average, we used to get about 20 to 30 hand injuries a day.
Big number.
Yeah, very big number. That includes minor and major. So the first thing I learned there is, if you start saying that I will see only major cases, then you will never get hand injury to your place. So that all inclusive is something which is really important. So our chief had one good thing, one red line starting from casualty, going up to our department, going through the corridors of the Stanley, so that anybody comes with a hand injury will follow the red line and come here, rather than go into the casualty, get there, bogged down. So, or somebody sutures and sends them off with a tendon injury inside. So that is the first lesson I learned. See, a direction, solving the local problem in a local way, rather than just think about some wild things. You learn it from Britain or from the US.
Yeah.
This is something which I really like. And once a patient comes in, the second thing I noticed there was one wooden stool was tied to a table where the patient has to sit. Again, the common thing, if you put a chair, one person will move it to have his lunch there, other person will leave it to fix the bulb above,
Yeah.
and when the patient comes, there will not be a place for him to sit. So he has tied a stool to the table so that nobody can move the stool. So such sort of a funny things which I realized. Then only I thought of realizing I think we will have to localize solutions also to local problems. Then went on. I was there for 13 years, again as tutor, assistant professor. I loved teaching, and then grew up there. But there was a problem for me. Even though when I passed out, I was 4 in waiting list in promotion. Then I became 7 in waiting list.
Oh.
Then I became 13 in waiting list. Then I became 16 in waiting list. Because the rule there was it depends on the service you have put in. And you should have a minimum of 4 years of teaching experience. So anybody who joins later up for me, my own students, when they complete 4 years, if they have joined service before me, then they get promoted. And then I still remain as a tutor. So I thought it's not possible for me to get into a bigger role. And also, I thought it is high time that I get liberated from the setup, which is like institutional setup, where you are not individual of yourself. No, it comes into the. So I went in, became a consultant in Apollo. Exactly the opposite. Here, everything was general surgery. Sorry, poor people, moderate people, and there everybody is a corporate setup.
Yeah.
There's a government setup to corporate setups I moved. But one thing I realized was the fees is something which I decide how much I collect, not the hospital.
Mm.
Therefore, if I want to do more, naturally I should be affordable.
Yeah.
Therefore, my charges were comparatively low, but I had more patients. So slowly, patients started drifting towards me, mainly because we also affordable, accessible, at the same time, you get a good treatment. So quality of treatment with affordable cost was something which is important, which I would like to tell everybody later also in the conversation they can get. So I started getting more. And in such a way that again I was liberated. So I started doing all different subspecialization in plastic surgery also there. I was doing initially aesthetic. I was doing hand because 13 years, donkey years I've done hand. Then I started craniofacial in Apollo. Then I was doing more maxillofacial work. So that way it was really great. And of course, I was doing micro before. So micro brachial plexus, craniofacial, maxillofacial. So that looked like a big spectrum, which very difficult for any single individual to do. So that way, that corporate setup, 18 years of that gave me a big boost. And the patient to patient, that is the best advertisement you ever get.
Absolutely.
And I started doing quality work there. And of course, a lot of CMAs, I became known, and then the journey became well. Then I was also the director of operation theaters there in Apollo. So I learned about the operation theater, building that. Then I started modifying some theaters there. The management liked it, and then they started sending me the drawings of other hospitals they built for me to give me a view on whether that is all right. That way, I started a passion for operation theater design.
Okay.
At that time, somebody went and started a new hospital, called me to come and then design the operation theater. So I have designed here 13 theaters, which is a very good, one of the very well standard theaters, I must say,
Yeah.
that we built our theaters. So there, then what happened was the CEO at that time had to leave, and that fell on me. Then I became sort of a vice president of the entire institution, and then completed the construction of the hospital along with my colleagues. So we did right from the brick foundation to the hospital. So those 2 years, my practice was almost clinical work was negligible. I was operating elsewhere. We grew up that way, built the hospital, then the management, same management of SRM. It's a corporate setup of SRM Medical College. They asked me whether I would love to take up the academics there. So I moved there as a pro vice chancellor. Then I was managing both the places, corporate setup for 3 days and pro vice chancellor and academic for 3 days. And that was a really nice period in my life where I was morning to night, I was really occupied fully and various roles I have played. And I learned a lot during that phase. I think every role you play, you learn.
Definitely, definitely.
That's it.
It's been 47 years. You joined MCH in 78. I was born in 78.
Yeah.
So it's been a phenomenal journey. And you have been, now you have played multiple roles. You have been an academician in the initial part, then clinician in your role at Apollo, and then in administrative roles as well. So what do you think is the toughest of all these roles, and what did you enjoy the most?
I think the toughest always is administration. The reason is man management is the worst thing, is the most difficult thing. And managing an educated man is much more difficult than managing a laborer. I think you will agree with me.
Absolutely.
Especially people who are specialized in one focused area, very difficult to manage because they do not understand the problems of the other side. So they view it only with their focus in mind. So cardiologist comes only with the cardiologist's viewpoint. A surgeon comes only with the surgeon's viewpoint. So that is something which is very difficult to balance. And the managerial position in a corporate setup is entirely different from bureaucracy in a government hospital. They are entirely different lot. And these people are entirely different lot.
So talking about bureaucracy, as you climb the ladder gradually, you get more and more into the administrative roles. So does bureaucracy and politics actually influence decision making, or rather, I should put it this way: how much do they influence the actual decision making in government sectors as well as in private sectors?
See, bureaucracy, politics can never be separated out of our life. Period. So you have to accept that. Now, how to manage is the question. Again, I would like to recall Professor Arvi. He used to tell it is like fire. If you are very much away from that, you don't get the warmth. If you go too near, you get burnt. So that balance is something which you've got to strike between politics, bureaucracy, and your professionalism. They are required, but you have to play your game. And the balance is something which is very, very difficult. I think as you go up, as you said, as you climb the ladder, only you face all this. By that time, you have reached enough of maturity to handle.
To have that balance sort of thing.
Yeah.
Right, right. Again, as you go into more and more, as you climb the ladder, you go in more and more of administrative roles. And obviously, these administrative roles come with their own set of criticism, both constructive as well as negative. Probably negative are a bit more because people on the other side are not able to understand your point of view. So, how do you take this criticism, especially the negative ones?
Yeah.
Because positive ones are fine.
See, it again depends. I would like to tell you, even in the academics, for instance, or in the life as it is. For example, let us say, or a simple example I'll give you. When I gave the Gillis oration, the topic I put was, are we losing out?
Okay.
You know Ramchandran, an aesthetic surgery, hair transplant surgeon, a very good friend of mine. So when he came, I was doing the preparation. Then he said, show me. So I was just showing him everything. He just saw a few slides. And then he said that you want to convey that it is not that losing out. We are not losing out, isn't it? I said, yes. Then don't you think, are you really losing out will be a better top heading than are you losing out? That only that one word really, actually really made a difference. So that's a positive criticism.
Yeah.
And then he said, I found at least three spelling mistakes in the whole thing. I realized, then he said the ghastly one is in the title itself. When I looked at it, I realized I have put LOO, loose.
Acha.
LOSE, LOOSE are different. Oversight, I have put LOO. Then he said, there itself, first itself, it is a ghastly mistake when it comes striking.
Mm.
I said, yes. So this is positive criticism. Now, you must understand first the criticism. It's a balance you have to balance. Who said that? Whether a guy who is really interested in your welfare or not. Another person, you know very well, he purposely wants to pull you down. Let's say smoking.
Mm.
Once upon a time, I used to be a smoker.
Yeah.
A good friend used to tell me, Sridhar, I think it's time you reduce it. The same, another person will tell, oh, that guy always is a chain smoker. Even though if I smoke only three, he will label me as in public, in my absence. So that itself is an, and that guy will come and tell you he commented on you like that. These are the actual negative comments. Same thing in administration. So you know who made the comment, in what context they made the comment, whose presence they made the comment. I think all these have to be weighed, and majority of these negative you have to leave out. Otherwise, you will never progress. Actually, I wrote a poetry on this in Tamil because Tamil I sometimes write poetry that to myself. There I wrote, giving two examples from jokingly from Mahabharata and Ramayana. I said, if Duryodhana has listened to Krishna and concealed his genitals with a leaf, because Krishna told him, hey, how can you go to your mother with a leaf naked? So you conceal it. He listened to him and then went to,
Yeah.
he opened her eyes, saw everywhere other than his thigh,
Mm.
and then Bhima could hit the thigh because he was supposed to protect with her vision Kandari and then
Yeah.
protect him. Same way, Rama listened to a Dhobi who suspected whether Sita can be brought back. So he tested her on going to fire. I said, even in Ramayana and Mahabharata, you listen to others, you can never progress.
Right.
Same way, you have criticism from others. If you just give enough, too much of weightage for that, you can never progress. So you weigh that constructive criticism, destructive criticism, negative, positive. I think we must mature enough to just forget it, leave that guy.
Right, sir. We were talking about, are we losing out? So you have been in a directorial position, administrative position in a hospital. Very often we encounter, especially in private practice, that oncosurgeons charge significantly higher than just for excising lesion, and our guys do fibula for hours together and are not paid at par with the oncosurgeon. Same thing is true for other specialties, ortho as well. So, being in an administrative position as a director of a particular hospital, as well as a plastic surgeon also working in that hospital, how do you think we should address these issues,
Yeah,
especially the younger generation?
correct. One thing we must understand, anesthetists are the worst in this. Who are guys who are at the mercy of others.
Yeah.
Ours is a slightly different. You compare to a pediatric surgeon,
Mm.
everybody puts their hand on pediatric surgery. They are also the same. So they now many of them in private practice do circumcision, hydrocele, and then hernia, and then be done with it most of the time. Otherwise, they go to a TEA, esophageal fistula, etc., which only a very senior guy is going to do. Now the point is this: plastic surgeons are that way, partly primary specialty, partly
Yeah.
dependent specialty. Wherever you are dependent, you are always dependent on them to charge. Right? That's the point number one. So, as a primary surgeon, you can charge whatever you want. The reason here is the patient goes to the oncosurgeon or not to you.
Yes.
So, they own them. At least they feel they own them. Another reason is what you are doing is not known to the patient.
Mm.
I never operate on a patient without seeing him pre-op or evaluating, whoever the surgeon may be. He has to send the case to me beforehand. If he says that I have a case here for cheek lesion, I'm excising, will you just come? I'll say no. I should see the patient early. When I talk to the patient, I tell him in a gentle way. I don't decry the other person. I tell him, see, he's an excellent surgeon. I've been working with him for a long time. He is operating on you. Good. He will just do the whole thing within an hour and a half. And then only I walk in. After that, to close up and then put everything back, I may take about 4 or 5 hours. When I tell that, the patient realizes that my work is much more. This takes long time. It has to be a practice. No point in shouting at the onco surgeon, you guy, you are charging more. No. There are neurosurgeons and orthopedic surgeons and ENT surgeons who have worked with me, who just come and tell me, Sridhar sir, if you are junior, otherwise Sridhar, you tell your fees to my secretary and then they'll go. So I charge my fees. I
Right.
may decide to charge less compared to an onco surgeon for reason that he has to look after post-operative, he has evaluated, he has done everything that way. But the discrepancy may not be.
Yeah.
Maybe they charge 1 lakh, I may charge 75,000.
Mm.
I think it's a relationships you have to build. Over the years, I have built excellent relationships with my colleagues. They respect me, I respect them. I think that's something which
I think
I have to revisit my Gillies oration again.
it is a slow process which evolves
It's a
with time.
slow process. It can never come over time.
Yeah. This
I
is
always tell this, that's a raw deal. We call it as a raw deal.
yeah.
I always tell raw is R is reliable, A is many, accessible, affordable. You understand? Accommodative, but at the same time assertive. You can say that this is what I have to do. They can't just tell me, just put some simple graft and then get away. No.
Mm.
I will be assertive, but they say that they have spent a lot of money, see the what to do. I said, okay, doesn't matter. I can reduce my fee, but this is what I will do. So I think that is, and then workable as a team. Raw, RAW.
All right.
Yes.
So coming to back to academics, actually, we
Okay.
all have seen that South India, especially, is the hub of academics. Be it any specialty, the ophthalm, major centers of excellence. There is ortho, laparoscopy, even plastic surgery. So, how is South India different? Because definitely you can't argue that South India is definitely the hub of medical education, academics. So, what is it different that South India does, and how can we replicate to across India?
I think I will slightly differ from you in this. Slightly. Initially, you will say Maharashtra, Bombay, for instance, and then Kolkata and Chennai were the similar in the British era.
Okay.
See, all these three places had primarily the hospital, medical colleges started.
Yeah.
I don't know whether all of you have noticed, all big hospitals were located near the railway station.
So mine is located near a railway station, BJ. Yes.
Everywhere.
Okay.
You just look at it, they will be very near railway station because air travel was not the thing, railway station was the thing. Majority of the villages from towns, they will come to the railway station. Straight across that you will find usually you will find the hospital
Yes.
across or nearby. Right? So all the major hospitals, major junctions were located in these places, in the British.
Mm.
And then post-independent, I think all these governments actually supported. Maybe Calcutta remained because of so much of turbulence in their political things. Here, their stability was there more,
Okay.
and the government supported. One more thing is we had an honorary system like Bombay, olden days. The very good surgeons and physicians were holding a unit without taking salary
Mm.
as honoraries. And that time it was a prestige to work in a government hospital.
Yes.
And they developed, a lot of them developed single specialties first. The neurosurgeon, cardiothoracic surgery, pediatric surgery, plastic surgery in at least Madras, Tamil Nadu started with doyens like that.
Mm.
So they really did the work and they were supported by the government. That is the reason. Now, if you look at the medical colleges, number of medical colleges started in Tamil Nadu by the government, whichever be the government, is very high. We have nearly 31 medical colleges in government, almost every one in every district. You compare it to any other state, it's not possible. So the number of money, rather amount of money which has been put in for starting the colleges is high. That's why.
But sir, I would like to slightly disagree on you in this matter. The quality of education or research what we see is more, I believe, in the private sector, not in government sector in
Correct.
South India.
Correct, correct. That's what I'm coming to. See, this is what how they established.
Yeah.
Now what happened? Many people started coming out of the medical colleges, government colleges, and then gone into corporate setup. Because as the boom in medical technology developed, the government was unable to invest on those, but the private was investing on those. And most of these guys who are academically good, they went in there, got training, and started using them. That's why you will find knee joint replacement, coronary bypass, microsurgery, craniofacial,
Exactly.
everything has come on to the private side.
Yeah.
That is a boom. That is the next level of initially why it started. Later on, it is like this. And now the third phase is coming now, which is the one which is scary to me. We will, as we go, we will touch upon that.
Right, sir. So now you have almost more than 4 decades you have spent, you have seen the evolution of plastic surgery for more than 4 decades now. What have been the significant changes over these decades, and what are the challenges that the younger generation of plastic surgeons face? I'm sure you in your time have faced a different set of challenges and that evolves. But studying plastic surgery over the years, what do you think are the
Yeah,
current
I started
challenges?
with tube pedicle. Tube pedicle is going away.
Yeah.
But still, we were doing tube pedicle, especially for the face. Okay? From then, we went into axially oriented. That's all were there, nothing else. Then local rotation, axially oriented, and then local flaps, and then regional flaps, like cross leg, cross fingers, delta pectoral was more. Uh, Even when I wrote my exam, the pec major and gastronomists were recent advance.
Hmm.
Okay, so it came under recent advance section. What are the things? So that's how we have seen the evolving thing. Slowly, then micro took over. I think that was the greatest revolution, if we can say it is microvascular surgery, which really changed the entire scenario of plastic surgery in our country. That's the first one. Second one is the perforator based surgeries. From the bigger vessels, we have started going into the smaller vessels. The third one is the 3D printing, I must say, which are revolutionized. These three, IT, that is computer enabled thing. These are the things. Now, challenges, if you ask me, is the fear which I have. I will combine both. What I express that there is a fear for me is the fragmentation of plastic surgery. That is going to happen
Hmm.
by too yearly subspecialization. In other words, after some time, people will not be in a position to do a routine flap because they have migrated totally to aesthetic.
Okay.
Somebody who has migrated to hand, which is very few, will not be able to handle a cleft lip palate
That has happened even now.
even now. So what is going to happen is now churning is taking place just like before. Now the margins of each specialty will merge and a new specialty will start. Now, even I myself is doing aesthetic gynecology.
Hmm.
Whether it is I who have to do, or gynecologist you have to do, or urologist you have to do, now itself there is a questionable thing. So this is what is the challenges which our people are going to face in plastic surgery. So my advice is don't subspecialize immediately. Work at least for 5 to 10 years And then your interest, you do, but don't leave. You understand?
Yeah.
I can tell I will not do brachial plexus, but I will do all.
Mm.
Another person can say, I will not do aesthetic, I'll do the rest. So you have to drop what you feel that you are not interested, you are not competent, but keep intact the remaining plastic surgery as a plastic surgeon. That is the one and the only way. I won't do cleft lip and palate. I will refer to my colleague who does cleft lip and palate plastic surgeon. I won't do hypospadia. I will give it to another friend of mine who is a plastic surgeon who does hypospadias. If that way we work, we can preserve plastic surgery. Otherwise, it is bound to fragment us.
Right, sir. Now, you always have been a spiritual person, even in Absicon, Rudra Shake, and all those things you have been doing regularly for past many years. So do you think spirituality plays a role in our evolution, in as plastic surgeons, in our decision making with respect to patients? And
I think we are like majority of the people we get we merge religion, philosophy, and spirituality. We encompass them into one. I
they're
think
different.
all three are at least subtly different, if not same. So Rudrabhishekam is a ritualistic thing,
Yeah, and
which
spirituality is
forms
different.
partly the religion. I won't call it as rich spiritual. Okay, that is going to be more a ritualistic, belonging to one religion. So it's a group of people who believe in something. Okay, that goes there.
Yeah.
Then spirituality is something which is you travel within you. You connect with the supernatural or transcendental or divine or whatever you call it as, in which you connect yourself.
Mm.
And philosophy is something which defines the way you look at life around you and try to change the life or suit the life or the way I practice life. So these three are different. I'll put it this way, the ritualistic one gives me peace of mind. Early morning, I start with a positive thing, nothing negative. I stopped reading newspaper first thing in the morning because I see only rape, I see only arson, I see only shooting, I see only killing. So I stopped reading that because that gives me a negative thing throughout the day. It's a chain reaction. So I would love to start something positive. So that way the puja or Rudrabhishek helps me. Forget that. That way some other person may pray, Christ or this, it doesn't matter. And then it sets a pattern in my life. It defines. In the army, they used to tell when you get up, you have to fold that
Yeah.
and then keep the mug and the plate in front. I think NCC camps you would have seen if you are
Mm.
on there. Why? Not necessary. One of my children used to ask me, anyhow, I'm going to put my rug again. Why should I fold?
Mm.
A very logical question. But the thing is, it puts you into a
Right.
habit, which is a disciplined way of doing thing. So next you get into the car, you do something routine. So all this rut of routine, you get used to. That is number one. That is about the religion. Spirituality, you see inner peace. You know everything. You are not great.
Mm.
You can fail. You must accept failure. There is something beyond you also which can happen, in which case, how to face it. I think that helps me in my patience. And then I also commit myself, patient centric philosophy that comes. The philosophy is patient centric. I always tell, let me first tell myself many times, let me first justify the consultation fees I take. Let me not think whether I am going to do a micro and earn 70,000 or I do a local flap and earn 20,000. But my first thing is what the patient want because he has already paid me my consultation.
Mm.
So that is a philosophy I feel that you have to inculcate.
Right.
All this way definitely helps. And in failures, spirituality really helps you out to tide over the crisis. One more thing I always tell, is don't worry about what you can't control.
Yeah.
That is something which is very, very important. You can't do anything about it. No point in worrying about it. You have to compartmentalize and go.
Don't let what you cannot do interfere with what you can do.
Correct. Absolutely.
Right. You talked about failures, sir. What about successes? What is your definition of success? How do you define success, both personally as well as professionally?
Success is perception.
Okay.
What is success for you is not success for me. What is success for me is not yours.
Yeah.
And majority of the time, success is determined by others about you rather than yourself. See, you tell that Dr. Sridhar has been a successful guy.
Hmm.
I may tell that Nikhil has been a successful guy. But I don't know what made me tell that, what make you tell that, because you measure it by the instrument which takes you to success. Like, or you think money is success, you think fame is success, you think position is success. What is success? To me, I think an accomplishment of inner peace is success. I must be happy. I'm happy today. With all the problems, I'm happy. I think that is my success. I must say that an accomplishment is something which is success. Second, you have a goal. You set a goal for yourself, right? And you achieve that goal. Well, you can call that as a success.
Success. So eventually, if you are able to sleep peacefully at night, that is success.
Exactly. That is precisely. I hit my pillow. Within the second minute, I go to sleep.
Right. Right. So over the years, you have been mentor to many of the younger generation of plastic surgeons, and I believe uh, many people apart from plastic surgeons as well. So, what do you think makes you a good mentor, or what qualities should a good mentor have, so that the mentee also grows significantly in the profession in life?
See, it is like, there is a proverb in Tamil. Pathiram arindi pichayid. That means, even when you are giving alms, you understand the begging bowl and then put. In other words, the need. You understand the need and give the alms. Suppose he wants food, you give food. If he's a cheat, don't give him anything. Like that. Same way here, if he is a mentee, I must first understand him what he needs. Every person is not same. I have my own four associates. I can say each one of them are different. So you have to mentor them in such a way, bring out the best in them. That should be your object, and not try to impose what your quality on him, which is not
Hmm.
possible. That is the first thing. I would like to tell you, oh, see, I have been doing this. You also must do this. That's not the way to a mentor mentee relationship. First of all, I must know what the mentee wants. Second, I must know what the mentee's strengths are. Third, I must know what are the mentee's weaknesses. Whether I must correct his weakness or I must substantiate his strength. That is what we have to decide. Then only you can mentor.
So, in-depth understanding of the mentee is
Is
important.
the most important than just to say that I will be a mentor, you'll be a mentee, and then I will do you. You can come up in life like me. I don't think it will work.
Right. So, apart from your academic inclination, administrative inclinations, and being a pro AC, you have also written a book on freedom fighters, the forgotten freedom fighters in Tamil.
Tamil Nadu, yeah,
Yeah, yeah.
correct.
So, what is your motivation for that, and how do you find the time to
I
write?
must, I must one more plastic surgeon I must compliment on this. That is our Surajit Bhattacharya.
Okay, his
I
blogs.
started reading all his blogs. That was one of the motivational guy. And one he wrote about writing blogs. He wrote a blog.
Acha.
What are the things to do for writing? Then I was wondering. I always love teaching. I always love to share what I know with others. So I was just wondering why not I also try doing something I always had fascination for freedom struggle. And one thing you know is the freedom struggle started in Chennai, which many people won't know, Madras Presidency, and almost same time in Bombay Presidency, and then in West Bengal and Punjab. I asked people who know me to name 10 Maharashtrians, 10 Bengalis, 5 Punjabis, and 10 Tamilians who fought for freedom.
Mm.
I realized everybody mentioned more of the central and north, never mentioned anybody here. I again asked me, tell me 5 Christian names. You couldn't. So these are people who have done so much but have never been mentioned. So I chose who all I knew because I was immediately after freedom struggle was over. We got independence in 47. I was born in early 49. Only 1 year elapsed. Right. I have heard a lot from my family. One of the family members himself was a freedom fighter. So I just wrote down in a piece of paper the names whom I knew and then struck off all those who are already known to the outside world, like Rajagopalachari, Rajaji, Bharatiya, like that. Then I got a list. I started searching on them. I started doing that. Then I realized I got a link from one to the other.
Mhm.
They would have said that he was arrested along with so and so. Now, I never heard of that so and so. Then you click on that so and do your research. Like that, it went on. I really enjoyed doing that. Then I wrote a blog every Saturday.
Acha.
Whole week I'll write. Saturday night I will put it across because Saturday night and Sunday morning people are convenient for them to read.
Read.
There was a positive criticism came from somebody. I don't know who he is. He said yours is too long. You must make it little short. It's really interesting, doctor, but I would like you to reduce the size. So I started reducing the size and then wrote. Then one fine day somebody asked me, why don't you put it as a book? It so happened that was the Swarna Jayanti Mahotsav.
Okay.
Then I thought I'll compile it. Then I searched for publication. Then I thought I'll self-publish it. I
Mm.
did a publishing. And then there was a guy who does publishing and also printing. He came in and then chipped in. It so happened governor was visiting one of the exhibitions of the Swarna Mahotsav, supposed to. So the same organizer said, will you release a book? So the governor of Tamil Nadu came and released the book on the occasion of opening the exhibition. So
Okay.
that way it went on. And again, yeah, I'm thinking of next pipeline is something I'm thinking of writing something in Tamil.
Like.
And it's a long time dream I must have. I have selected a lot of Tirukurals, which I wanted to make it to public to people more on not exactly translation. I would like to give it more with anecdotal, with stories, along with the Ramakrishna's, Vivekananda's, or some
Okay.
of the Tamil poets, and then fitting into that choral and then write. So that is one thing which I have been long-term project which is there.
Okay. So, of all these achievements, writing a book, being a pro VC, describing surgical procedures for the claw hand, especially for the intrinsic minus for the cupping, there are multiple innovations as well, starting a translational research department. A lot of things for me to enumerate, sir. What do you think gives you the most satisfaction, or what do you consider your greatest achievement of all these things?
I don't know whether they achievement. They're all things. My leprosy work, I feel that I'm really satisfied, and it's an achievement. Then the epidemiological survey which I did, cleft palate survey, which was a very mammoth one. Luckily, I had the support of the government of that time, the chief minister, and that so happened that she came and inaugurated our conference, and then I went in and then talked to her and then got this done. That was something which I feel is an achievement. And starting craniofacial without great training on my own to start to make our patients in the southern part have an access to craniofacial surgery is another thing which I feel is important.
Right, sir. I
That's
do remember your visits to Baroda, especially during my residency days for the leprosy camp.
correct.
You used to visit for every leprosy camp with a lot of enthusiasm. Sir, regarding that survey on craniofacial anomalies, can we not do something as an association to implement that at a national level?
We've
Because I
tried.
believe it is largely localized to Tamil Nadu.
No, even now it is not done here. See that what happens is until you get the government support, it's just not possible.
All right.
You have to use the governmental existing machinery and the person, which without their help it is not possible. Somebody takes it up at the national level, I don't mind. Somebody can talk to the central government and then trying to take it as a central government project. I don't mind chipping in with my experience and then doing it across. Actually, ICMR started it. I think Karuna Agrawal was also there in that.
Okay.
We all went and then started only for the cleft lip as an ICMR project.
Mhm.
Then I think it got confined only to a smaller level, and I don't know what's happened to that. I don't mind doing it. It should be done, but as an association, I think it is difficult.
It's difficult. The government
Somebody in
should.
the association powerful enough to talk to the government. It's possible. You have enough this thing with your government, at least your state we can replicate.
Get it, sir. So regarding the translational research initiative which you have taken, combining it as a multidisciplinary project for medical device innovations, problems of medical fraternity, engineering guys coming together and trying to develop solutions for it. Now, I think even that has got a very limited, I would say, impact. There are only a few centers which are limited or distributed across India. So, what of those people, of those plastic surgeons, of those residents who have that inclination towards medical device innovations but don't have access to the facilities? How can the Department of Translational Research at SRN help them?
I think we must start an association of translational research, wherein we must announce or we must talk to people from the engineer. I think IIT is a good field, but the
Yes.
problem with IIT is I think they already have a lot of research going on and they find it difficult. Now I'm doing one with IIT. It's very difficult in the sense there are so many things which are there in the pipeline for them. It's difficult. Suppose we get across some of the colleges, deans we talk to, directors or and then we ourselves association collaborate with them and then form an association, invite people, and then it is possible. I don't mind organizing it, but the thing is, somebody who is active in practice, etc., must give. See, we must give 10 problems,
Yes.
and then the 10th problem, if it is going to be translational into an equipment or something, it requires 5 different specialty of engineering, not single.
Yes.
So there must be a coordinating chart. There I was a coordinator.
Mm.
I invited problems. Then I realized this to solve the problem, who all I need. I need an electronic engineer, I need a mechanical engineer, I need a chemical engineer. Then I used to send them the problem, telling them this aspect of it you tell, this aspect you cover, this aspect you cover, and then come back with me. With the next week, they must come back to me with a basic idea. Basic, raw basic. You can just tell me orally, this is possible, this is possible, this is possible. Then detail we can see, and then we form those subgroup with those 4 people and then develop. That is the only way in which you can do. I think we must do this. You can even start now asking colleges in plastic surgery to give you the thing. I don't mind coordinating. Same way, send the letter to various engineering colleges. If you are interested, let us form an association. Let us develop and then make in India.
Mm.
Let it be make in India slogan.
Right.
Go with the Ministry of.
Yeah, so we have a couple of projects which are going on in collaboration with IIT and with the financial support from Department of Biotechnology. But I think the spectrum is anyways limited. If we see across India, hardly a handful of people are actually working on medical device innovations, and journey being so long that it takes almost 7 to 8 years for
Correct.
something to
Correct.
actually materialize.
Correct. Absolutely. We have to form an association. We have to form groups. I think you can take an initiative. You have that inclination. I think you can write to people who are interested.
Right.
Let's not sit in a five-star hotel. Let us sit in a room
Mm.
and then discuss.
Right. Sir, apart from this, what are the new projects in the pipeline which you are thinking of?
Oh,
You
now I think I am more into a little bit more of spirituality and then writing. Yes, I'm thinking of writing this. I told you in Tamil, and also I'm trying to translate a book. More into
yeah,
more of spiritual life. I thought that I will.
travel and trekking as well. You still do a lot of trekking.
Yeah. See, I started my trekking way back. I started it in somewhere around 85, 90s. I always used to go to Uttarakhand. Almost every year it was a religious trip. Religious, not religion. Religious trip to Uttarakhand. I used to do a lot of trekking there. Then as I aged, then I started giving up. Then I got stuck with all this appointments in
Yeah.
SRM, etc. Then I slowly drifted off. Again, we did our Kailash when I was 70. Then after that, I realized it's difficult.
Mm.
Both the knees as well as the lungs, I thought that it is not all that easy. It was tough. We somehow made it. After that, I think no more trekking.
Great. Now, sir, coming to the last two questions, which I believe are quite interesting, and I would personally like to know about it. So, if you would have to give one advice to your younger self, maybe when you started plastic surgery around 35, 40 years back, what
Yeah,
would that advice be?
I think only one advice: publish,
Publish.
which
Okay,
I never did
okay,
much,
okay, okay.
and leave early from the comforts of an institution.
Is it?
Don't toil for a longer time.
So, okay. So, I believe that was the advice which you are giving
Unless,
yourself.
I'm coming to it. Unless you hit the unit or you hold a position of independent thought process, uncontrolled, and you are able to do what you want to do, at least up to 75%. These two, I think. See, you have a chance of becoming a head or chance of becoming a unit head, and you can dictate your own terms to yourself. Then you hold on. Otherwise, I think independence is important. I don't know, you have a dog?
No, no. I have a cat.
Okay, you have a cat. I also have cats now. When you have a dog which is tied up to the chain, when you just release the chain, you will see the way it runs out.
Mm.
So I think the independence is something which is really required for you to put your thought process into action because that is what you are made of. Your thought process makes you.
So as long as we have our creative freedoms to take decisions to
Correct.
operate,
Correct.
so that's fine. Wherever we are
Or you must have a boss who is able to do
giving
that.
you that creative freedom or independence, right? So now, apart from this, one last question. I think you have already answered this to a great extent. But what final piece of advice would you give to the younger generation of plastic surgeons for a meaningful life, for a fulfilling life, and to achieve professional success as well as that peace when you lie on the bed, you have a peaceful night.
I think one of the important thing in life is to let go. Most difficult thing, but letting go is important. I have let go so many things, and one I think Raj Sabapati or Mukund Tate or both used to ask me this question. How is that every 5 years you are changing your shirt? That means I was a hand surgeon, then microsurgeon, then craniofacial surgeon, then administrator, then this academic. I think I have a habit, like, once I feel that I have done this, I think others can do that. Whoever is with me can do the remaining. Then I would like to change. I have a habit like sometimes I used to say I'm like a sheep.
Mm.
Nibbles this grass, goes there and nibbles that grass, never takes the whole grass, right? Maybe that's why possibly I have had so many things. And I let go, not necessarily hold on to the position. I have
Yeah.
let go every position I have left, and I find happy. Leaving it also gives you happiness. Number one. Number two, continue learning, never stop learning. The only impossible thing in life is to say, I have nothing more to learn. That is not possible, right? So you've got so many things to learn, either in your subject, not in your subject, somewhere else also. You can learn a new language, you can learn art or sports. Anything you can learn, but continue to learn.
All right.
Accept I can't do this. That is another thing. Accept I can't do. And say, learn to say no. I think this is all the things for life.
Great. Thanks a lot, sir. That was very insightful, and it was a pleasure having these candid conversations with you. I believe we have touched so many aspects of sort of plastic surgery as well as non-plastic surgery, and your insightful comments on various roles as a clinician, as an administrator, as an pro VC, as a teacher as well. So thanks a lot, sir. And I believe we will have some more of these candid conversations in, maybe we'll have you again in the next couple of months with more set of different questions and with somebody else along with you, so that we can have some more interesting discussions and arguments as well.
This is something I must thank you for bringing out the best answers from me.
Oh,
I must say, if you feel, I think you brought out the answers, you phrased the question so beautifully. I think
thank you.
its credit goes to you rather than I have only answered the questions.
Nice, so that was
Thank you.
the entire thought
Really good.
process.
Thank you.
Thank you so much, sir. I think we will conclude. Thank you all for being a part of these candid conversations with Sridhar, sir. I think in the next week or so, this will recorded version would go live on YouTube as well. So thank you all. Thank you, sir. I think we'll conclude.
Yeah.
Thank you, sir. Bye, sir.